In Norway, we have a saying: if you want to know where the shoe is chafing the foot, you should ask the one who's wearing the shoe. This illustrates in a very good way, I think, how users can influence services or products by telling how the service or product influences them. It's quite a basic concept, but really difficult, it seems, to take into practice. One problem might be communication. I think anyone that has bought a technical product from someone with a lot more technical competence and knowledge has encountered kind of a language barrier, but not only a language barrier, but also a problem of levels of power, because the person with a lot of technical knowledge and tools and know-how has a lot of power on how to specify what the product should be, instead of the client buying the product. This makes user influence of services, user participation or user advocacy difficult, but there's an added barrier. The barrier of differences in power, which actually makes something which could be true from one perspective into an untruth from another perspective. I'll show you how. But first we must think back to the 1960s and 1970s in Western Europe and the United States of America. Student uprisings, new ideas, new feminist ideas. In particular, one idea that bras are a symbol of male oppression of the female, and subsequently that bras should be taken off and burnt. This happened. We can recognize the idea, we can recognize the symbolics of taking those, going without the bras as a symbol of liberation from male oppression. But let's imagine that it happened in a slightly different way. Let's imagine that the idea came from white middle-aged males, stating that the bra is a symbol of oppression, so we must force our women to take them off. Suddenly it's not liberation, is it? It's oppression. It's the same basic idea, but coming from another perspective, it's oppressive. It's an absurd idea, isn't it? White males telling women they should take a piece of clothing off to become liberated. Tell that to this woman. We, at least in Norway, people are seriously stating today that some women that are wearing headscarves should be forced to take those off, otherwise they cannot become liberated. How on earth can you liberate a woman through forcing her to take off pieces of clothing? It could be an act of liberation somewhere else in the world if a woman took off her headscarves. Let's imagine Iran or Saudi Arabia. But then it comes from the perspective of the person wearing the scarf. That's what makes it an act of liberation. Now, what this means, which is kind of scary, is that any service or any model coming from some place of a level of power and being taught to someone with less power automatically is a model or a theory of oppression. It means that you cannot have a social service which is not oppressive to the clients. It means that you cannot have a mental health service which is not oppressive to the patients. Abuse will be part of the model because of the differences in power. Now, I'm not saying that we should avoid social services, that we can't have mental health services, that we can't have technicians with knowledge because that power makes them abusers. I'm saying that we can do something about balancing the scales. How do we do this? Well, more than 10 years ago, I joined an organization, an emerging organization in Norway called the Norwegian Association of Mental Health for Youth. A couple of years later, I lost all my rights to vote or have a voice within this organization. Why? Because I was too old. This is an organization made up of patients to give themselves a voice and come to their own conclusions about what needs to change. So it's owned and governed by members below 30 years of age. You lose all your membership rights when you get older. They've employed me. Later, I had to ask them for permission to come here and speak. That's kind of cool. We've made changes in Norway. One of the first things we addressed was the problem that if you're, imagine you're approaching 18 years of age, you have a mental health problem, you go to an institution, you start talking to a therapist, you establish a relation for treatment, then you turn 18 and you're kicked out of the institution, and you have to stand in line for 6 months to get into the next institution and establish a new relationship with a new therapist. This was the reality 10 years ago in Norway for those starting treatment before they became 18 and having to continue treatment after becoming 18. No one had addressed this as a problem until our organization emerged, because there weren't someone who was wearing the shoes in position of power to actually address the problem. It was our problem. We had to do something about it. So what we did was we talked to some politicians in an opposition party in government. A couple of months later, new guidelines. Problem solved. Well, we created new problems in the process, but that's another story. What we discovered in this process, and several other such processes, was that changing the system for us, being actively heard, being voices, proponents of change, influenced our health. We became more healthy through this. Also, taking on responsibilities for ourselves, for our fellow members, made us more healthy. One of the most important things we do today is order pizza. I'll tell you how this works through a story. Oops. There it is. Oops. Now, we're back. Now, this is the story about Maren from southeastern part of Norway. She, first time I encountered her, she was really sick. She had weekly admissions to hospital to get stitches because she cut herself too deeply. She overdosed, I think, several times a year, trying to, I don't think actually trying to kill herself, but trying to escape her emotional problems. She was part of a local chapter in our organization that ran a meeting place. They borrowed a place from the municipality where they could stay and just talk, have pizza. Now, the founding members of this local chapter, they went to other cities to study, leaving her more or less alone with this meeting place, and said, well, here's the key. You can take it. You know how it works with the money for the pizza. So you can take this responsibility, or you can just let this meeting place die. And she thought, well, I need this meeting place, so I'll take that key. It's a scary thing to do, but I'll take it, and I'll keep this meeting place open. And she did that continuously for half a year. I think first 4 or 5 months she was there alone. She just felt she needed the responsibility. After a while, people started coming. having pizza together with her. They bought some board games, they started playing, started finding out what their local municipality at home was doing wrong with their services, started fighting for change. Something happened in her life, because she was taking the driver's license, and the doctor had told her that he couldn't allow her to drive while she was having weekly admissions because of self-harming, because a car is kind of a powerful tool to harm yourself with. So he wasn't sure what would happen if she had an emotional episode behind the steering wheel, and she totally agreed. But she said, well, I've been keeping this meeting place open now, weekly, without fail, for more than 6 months. I could actually do that. I didn't believe that in the start, but I could actually do that. Maybe I can stop harming myself so that I can get the driver's license. And the doctor said, well, okay, if you can prove to me a couple of months with no episodes, I'll give you the driver's license. She's got the driver's license today. She's moving on in her life. She's building communities around her. She's also left the original meeting place, but she trained others to take her place, which are doing the same thing now that she did then. I asked her, could I use your story and your name? She's not anonymized. I asked her, can I do that? And she said, well, of course, you should, because this is about what we learned through working in our organization. It's about being the examples of change, to be our best examples in our struggle for our redemption. And that's basically what we're about. That's why we need such organizations. How do you do that? We cannot tell youth, you should organize, because then you're basically back to doing the same thing as telling women to take their clothes off. But you can make the resources available for such structures and organizations to emerge if they want to. It's an easy question of low-level funding. Very easy question of very low-level funding. Doesn't take much money for pizza. We actually went through the accounts of the local chapter from where Maren came from to see how much public spending had gone into her life changes. You know what we found? That cost us 11 pizzas. Not equivalents of pizzas, 11 actual pizzas that she ate. That's what it cost. Now that's a cheap health solution. So with the right funding mechanisms that allows communities to create themselves and take power, not receiving power, take it. And through legislation that forces services, politicians, to bring such organizations, their advocates, to the table when new legislation, when new guidelines, when new health systems are built, you create something that doesn't only provide better services through user advocacy, but the users themselves become more healthy. Because to quote the great teacher Paulo Freire, who is famous for having taught literacy to quite many Brazilians, the oppressed must be their own examples in their struggle for their redemption. Thank you.